I'm almost at my second year of psychiatry residency and failed step 3. That is all crashing down on me, on those feelings of not being good enough, those feelings of failure. And I've met with medical students who have failed step exams. Listen to your gut. That's something that I tell medical students when I'm tutoring them. And it's important to remember that you have the content in your brain. Trust it. And I think that was another thing that I noticed that I did. I was double guessing, and that's when I do the wrong thing. That's when I change my answers from the right answer to the wrong answer. You don't know if you'll have anxiety that day. You don't know if you won't feel good or didn't sleep well. Hindsight's 2020, right? Hey everyone, this is Dr. Moss. I am here after I heard back that I failed step 3. It's been now almost 9 months of psychiatry residency. I'm almost at my second year of psychiatry residency and failed step 3. Yep. It's been about a week and a half. I haven't told many people, and this is the first time I really announced it publicly. Yeah, this is a hard one. I failed step 1 twice and then passed step 1. I did well on step 2. I was able to come back from a leave of absence. I was able to do all my clerkships. I applied to residency, got tons of interviews in psychiatry and family medicine. I matched in psychiatry. Anyway, at first I was gonna do this video right after I took the exam, and I was like, I have all these suggestions of how to study, how I studied, and I'll still do that. I'll still include what I did. But I'm gonna go a step further from a person who now failed and tell you what I wish I did. And now, obviously, what I'm gonna do going forward. I'll talk to you about what my program director said, my residents have said, my chief. This is so hard. And now of course, I've got it before, but it's been a couple years since I failed. And that is all crashing down on me, on those feelings of not being good enough, those feelings of failure. And I've met with medical students who have failed step exams. And I've said I've gotten it. And I said, it doesn't mean you're a failure. And so like I'm rethinking about the things that I tell others, the things that I told myself, the things I tell and try to tell myself that now that I'm in the failed position again. I hope this helps. Maybe this will be more therapeutic for me because I'm verbalizing all these negative thoughts that I've had in my head, which I know I've had before when I failed step 1. And I know are in the thoughts of individuals who fail step 1, step 2, or step 3. And I know people who have gone through failures and overcoming every single step exam, and they're attending doctors. Through this journey of sharing my own struggle, I've learned a lot. But let's go forward. Let's talk about what I did and what the exam was like, because I've now been it. I've been through it. I took it about a month ago. I'll share some of the things I noticed about the exam, some surprises. There's 2 days. First day is multiple choice. Second day is longer multiple choice questions and cases. So very foundational science, biostat, and patient management. I'm going to say that. I'm glad I had accommodations. I can't imagine doing step 3, 9-10-hour days, 2 days in a row. I couldn't do that. And I'm glad that I split it up over 4 days. If you split it up into 4 days, it's 2 days of multiple choice, a third day of long multiple choice, and then the 4th day is all the cases. And I think there were like 11 cases. So it split it up by 5-hour day, 5-hour day, a 7-hour day, and a 5-hour day. And I know I work better in the mornings. And so I did in the morning, and then 1 o'clock hit. I'm like, oh, I'm done. So that was definitely nice for my mental state, my physical state. I do recommend other medical students do that. If they've failed one step exam, whether that's one, two, or three, to definitely look at seeing if they qualify for accommodations. So if you haven't seen my exam or my story before, yes, I'm in psychiatry residency, which means that we only get 1 month of internal medicine. So I was like, okay, that's where I know that's where I do better post clerkship. That's what step 2 was like, seeing things in real person, studying, like, but then right after my internal medicine, I was like, oh, wait, I'm going to be on infectious disease. There's a lot that we have to know for infectious disease for the exam, for the CCS cases, which are cases where you're literally going in, putting in lab orders, putting in antibiotics. So I was like, okay, infectious disease, that'll be helpful. And then I got to neurology and I was like, oh, I'm going to focus on my neurology. And then I also got distracted with other things. If you know me, that's how I deal with my trauma and my stress. I make new podcasts. I write articles. I meet with med students and edit their personal statements and interviews. I did other stuff because I did not want to start studying because of that trauma that I went through during med school of studying. And I just met with a med student earlier this week that also similarly had that struggle after they failed step 1 and doing it again. And I was like, you know what? You're not using UWorld to study. It's almost like a trauma response that you're doing. You're spending the least amount of time on UWorld because it's the most similar to the actual exam. And that was really interesting. And so now reflecting back, that's exactly what I was doing too. I was like, no, I can't do it now. Oh, it'll be better if I wait. Oh, I have time later. And then I was like, okay, beginning of the year, now it's time to study. So I had 2 months, 2 electives. I was like, okay, this is the months that I'm gonna get started. I had done UWorld, really getting into the questions, and it was hard to get back into the questions. And it really hit me of like how much getting into residency where you're actually with patients, where what you say actually matters, what you say actually makes a difference in patients' lives. When you're the leader of a team, you're not just answering A, B, C, D, and things that are the right answer on the test are not the right answer in the real world. So anyway, January, I was on an elective hemonc, and my fellow was nice enough that he knew, he was like, you're taking step, focus on step. If there's a cool patient that maybe is similar to what you're studying or a unique case, like polycythemia vera, any type of lung cancer, we'll all invite you. So it was so nice. And I think that was really lucky that I had that opportunity. And I think that other individuals don't have that opportunity. I definitely know that, like my husband, who's a neurology resident, when he had to take step 3, he was literally 80-hour weeks in internal medicine. So like he lived and breathed internal medicine. And so there was less studying he had to do versus not the case for individuals who don't do that, like me in psychiatry. Maybe if you're in pediatrics, going to now all the adult medicine, that would be a challenge. Maybe if you're in surgery and focusing a lot on surgery. So it's very different, each different specialty, each different residency, and how much time they give you. There's not a set dedicated time. And I knew that. But speaking to the senior residents, which is always important to do, they're like, oh, don't worry, you can take it whenever. Maybe take it between end of your first year, sometime during your second. So I was like, nope, I'm going to get it done with at max like a year after I've been studying in med school. Looking back, I really wish I had just studied and done it during my 4th year, right before residency, because real life clinical did not help me that much. And if you think about people who are IMGs that have to also take step threes, or if you don't get into residency, they still sometimes expect you to take step three and you don't have clinicals, so they get it done. It would also have been nice to not have any responsibilities. If you look back at my step one, when I failed, it's because I was focusing on other things. There were other things distracting me, whether if that was the financial struggles, COVID struggles, health struggles. So similar, I still had these background distractions. I still had to go to my elective, even though I wasn't being there fully mentally present. I still had to drive an hour to get there, drive an hour to get back. During the drive, I added the podcast Divine Interventions, which was really helpful. Other people had mentioned before, I just hadn't had his time. So it was helpful. Definitely when I do it going forward, I'll be doing more of those and more of the high level review ones because especially the first half of step three was not a lot of details. And I was surprised on that. It really is true that step three is easier in the sense of there's not random details, it's more overall thinking. It's like the general of general medicine, no specialist. It's like the general of that you have to know. Let's say general cardiology and the basics. So they're not asking about tetralogy of flow. Maybe there was one question, but there's not very specific high-end genetics. If it's rare, it's most likely not going to be on step three. I wish I would have more focus on the bigger main concepts, and that's also what I'll be doing. Something that also surprised me was how much biostats there was. I knew there was going to be biostats, and I'm really glad I at least had some of the common equations memorized and I wrote them down at the beginning on my paper, which I always recommend when I'm tutoring med students. I never touched the UWorld biostats. There's an entire section of them. And I was like, no, focus on the Q bank. No, and I should have done that. And I will going forward. And I'm looking over here because I'm looking at my UWorld. I wish I would have done the biostats because I would say the majority of the first day was on biostats with a couple little spread out random little things of medical. A lot of reading journals, journal articles. And it's not that the journal articles were complicated. They obviously take time to read. But yeah, going forward, I wish I would have done that. It really makes me upset that I have to do that all over again because now I have to take 2 weeks off of clinicals. And obviously I want to be in clinical as I want to be an inpatient psych. That's like the reason I do what I do every day. That's my meaning. That's my purpose. So that's a struggle and annoying. So why is step three important? Because I can't apply for my clinical license, like to moonlight. So that's really the big thing is, and I'd be a second year anyway. We can't moonlight anyway until third year. So that's why we don't have to do step three until second year. So it doesn't matter that I failed in that sense because I still had an additional year. I'm told it won't affect fellowship in psychiatry because all they care about is the board exam. I know I'll do really well because I already did the PRITE exam, which is like psychiatry, and I scored like a third-year psychiatry resident. And so that made me feel better that I'm in the right specialty. Oh, this is hard. Okay. I thought I was doing well in what I was doing. Back to my lessons that I learned while struggling with the step one exam, doing 40 questions at a time, timed and mixed. Always recommend people do that because that's how the test is. So I'm glad I did that. So let's look at the question banks. And I'm looking down. I got through 80%. Okay, I used 80%, but I only got 52% correct. And the reality is I should have been scoring 60% correct in order to know that I would pass. And I wasn't as close as I was for step one, which means my content knowledge wasn't as strong. So I should have waited. And usually that's what I do. What I did in step one is, even though I did feel confident that I was going to pass, I did pass a couple practice exams, but I did have that buffer zone that I always recommend others to have. And I was so focused on, I need to get it done. I just need to get it done before I start my inpatient psych. And I did push it back 1 week, but I should have pushed it back longer in order to finish all of UWorld, in order to increase my percentile to be closer to the 60%. Yeah, I did all of UWorld 1, like the UWorld 1 practice test, UWorld 2 practice test, and then I think there's only 2 NBMEs practice tests. And it's funny, the first UWorld and the first NBME, I failed barely under. So I knew I wasn't ready. But then the second two, I did pass. So I passed UWorld 2 and I passed NBME 2, but again, did not have that buffer. I was just like a couple points or percentages over. And I recommend everyone, and recommend myself, is to have that buffer for, because you don't know what's going to be on the exam. You don't know if you'll have anxiety that day. You don't know if you won't feel good or didn't sleep well. Hindsight's 2020, right? But always, as I recommend, UWorld standard for questions. There is the first aid step 3 book. I had it. I thought about reading it, but I was like, I don't want to. I should have, right? Why not? But always focus on questions. And it's hard when you're in residency because you do have to balance being on 16, 24-hour call shifts. Usually you can't study during those, or you can a little bit, but then you get exhausted. So it's really important to recognize, do you want to do this again if you fail? No? Maybe it's better to just push it back. Okay, let's talk about cases. I did actually do the UWorld cases just to get a feel for what it was like. I was told like they're not as good. So I did do all. I know that the CCS website is better. And I did do those. I just didn't do enough of them. I separated those cases into the high yield and I worked through, but I started later. I think if I would have started it maybe halfway through my studying, I would have been able to get through all those cases. And that's what I should have done. I only focused on the high yield, which did show up on the actual exam. Those points add up. So let's see, of the practice cases, oh yeah, there is only 41 cases. And so I did do all 41 cases on UWorld, but you have to self-grade yourself. So for me, it was really just to get a flavor of what they're looking for. And then the CCS case website is really where it is. Through that, later than I wish I did, I started actually coming up with a high yields document on my phone, where I was like, this is the main topic. These are the medications you use for that, because that seemed to be where I struggled the most since I wasn't on internal medicine month. It's hard because you had to just name them in the moment and put them in. And so I think that's where I struggled. So I had that list on my phone of the highest yield cases, and I'll quickly list some of them that were high yield. So heart attack, cholangitis, DKA, overdose, heart failure, preeclampsia, celiac workup, HIV, meningitis in all different ages, TIAs, myasthenia gravis, sickle cell, cystic fibrosis, COPD, and asthma. I'm sure there were a lot of others, but those were the high yield that I did and I put down, these are the labs, the high yield labs you need to order, and these are the medications. I really wish I would have maybe reviewed that or made that earlier. That would have been helpful. But it's hard to like just pull them out of thin air, especially when you only have a set amount of time on the CCS cases. I also saw some great videos that, like, no matter what, the first thing you do, once you read the case, you go and you do the physical exam. I thought that if you go and put in oxygen because you think they need oxygen, they will ding you for that. They always want you to physical exam and then put it in. So physical exam, I struggled with trying to determine, do you want very targeted or do you want all of them? And from what it seemed, they always wanted you to do heart and lungs, no matter what. And then if it was like an emergency, you could do heart, lungs, and then everything except for the sexual organs, and that was okay. But if it wasn't an absolute emergency in that second, then they dinged you if you didn't do every single. So it's like every single organ system, which seems like a waste, but whatever. And also inappropriate in the real world. Like, you're not going to do a sexual physical exam or genital exam on an asthma case, but whatever. And then this was weird. You can order like X-ray, CT from outpatient and it gets done that day, which obviously that doesn't happen in real life. So I thought you had to only be in the emergency room for that to happen. No, they also ding you if you don't move them to the emergency room fast enough. But if they're in emergency room, all the things for every single, they will not hurt you as long as they're not too invasive. So always order, what was it? I'm trying to remember. It was like CBC, CMP, CMK, liver, lipid profile, A1C. You had to specifically write out pulse oximetry. They're also sometimes named really weird. So you have to learn how they specifically write it out. And that's why those CCS cases website is important, because they're named like a really weird way. Mostly want you to give them regular saline. Also, you don't need to say put in an IV, which I thought was weird. They also want you to almost always do chest x-ray and EKG and oxygen. It's also helpful. Ooh, that was a big thing. You don't want to provide them any treatment, so any medications, until you've ordered. So the steps are: read the patient, what is their history, their HPI, do the physical exam, put in orders, click submit, it'll let you go out, then click again of what you want to order, as in like oxygen and saline. It wouldn't matter, especially if you know right away you're going to do oxygen and saline, but it does not like it. So different little things like that. Okay. And then they want you to work it up as if you're a specialist, but then consult a specialist once you have a good idea of what it is, which I thought was weird. And also, being a specialist myself and doesn't order specialists, there are really specific names for specific types of specialists and specific types of surgeons that they want you to ask for a consult. That was really weird. And some things are not together. So like a urine analysis, and you have to do a culture, and then you have to put in every single culture of what you're looking for, like bacterial, fungal, that sort of thing. Same thing for the antibodies. You have to put in specifically one antibody. A trick I found that was helpful is if you just can't remember for the life of you one antibody, you can write in antibody and the list will come up, and then you could either select all of them, but that also wastes time, but it helps you like click them easier. What other things? Toxicology screen or pregnancy. You can do urine and blood. Overdose. It was really weird that they wanted you to do a charcoal, which normally we don't do a charcoal when someone is intubated. That was really weird because that's what we wouldn't do in real life, because they could aspirate. These little things that I feel like you learn through doing the practice, even though it's not 100%. Stool, also, you have to put up stool fat, stool ovas. I feel like one of the big things I struggled with is trying to remember names. So that's definitely what I'm going to do more of. Focus on clinical reasoning, not just memorization. Memorize the big concepts, the most common main diagnosis, not the rare diagnosis. Like always, time management. If you're spending too much time on your questions, flag and skip it, or put the answer you feel in your gut. Listen to your gut. That's something that I tell medical students when I'm tutoring them all the time. And it's important to remember that you have the content in your brain, trust it. And I think that was another thing that I noticed that I did. I was double guessing, and that's when I do the wrong thing. That's when I change my answers from the right answer to the wrong answer. So notice if you do that on UWorld, it will tell you if you switch your answer, cross out answers if you know they're wrong. There's always things there like there's no way that's true. Trust. Pace yourself. Pace yourself on studying. Pace yourself. You don't have a strong deadline when you're in residency. Not like step 1 or step 2. Give yourself breaks and mental rest. Do something you enjoy, but don't get too caught up in that. Definitely, that's what I do. That's one of my biggest problems and challenges is I'd rather do other stuff than studying. Hopefully this was helpful. And I'll talk a little bit about what my program director said, my seniors said. They were really supportive and they were just like, oh yeah, people fail. It's not a big deal. Even one of my attendings was like, oh yeah, people fail on that exam all the time. No big deal. Just take it again. Or I'm sorry if that sucks that you failed. More in this, it sucks that you have to do it again. So I was very thankful that they were that supported, but I've also felt very alone. Just like the other step failures, people don't talk about them. And so I get it. I get how alone it feels. I get how painful it is because that's what I'm struggling with. I haven't even told some of my friends and family members that I'm so worried they'll see me differently or they'll see me as a failure, how I see myself, or they'll be disappointed. But I know intellectually, it's not that they're disappointed in me. It's just they're disappointed in my experience. And that is the reality. And I know I tell other people the same thing, but it means so much different when you're in experience. And I'm guarantee, I bet if you're in that experience, you get what I mean. But like always, you're not alone. I'm in this with you. And if you want to email me saying you failed, don't even tell me your name. Just help me feel like I really am not alone, that I'm not the only one who's failed step 3. That would mean a lot to me, but you don't have to. If you failed, it's not a big deal, even though it feels like it. And I'm saying it out loud to remind myself it's not a big deal, but it's also the reality. So moving forward, I'm going to listen to my own advice, focus on my mental health, focus on my physical health. I'm glad that I tried to do some of that. I tried to do more exercise, something that I could never do during medical school or during my step 1 because I didn't have time, I didn't have the money. Thankfully, you're in residency, so you should have more time. You should have more money because you're actually getting paid for once. Trust yourself, trust your training. You got this. I hope that this was helpful from a resident that is working really hard to take this. I'm still deciding when I'm going to take it again because also something that I give other people's advice when they fail, and I'm trying to listen to my own advice, trying not to jump right into studying because that's where people fail the second time or the third time because they're burning themselves out. And so I'm really trying to, this is literally the first time I've opened UWorld in almost a month because that's when I stopped studying. So it's a balance. It's a balance of getting back into studying, when to get back into studying. I'm just going to close it that way I don't stress myself. And it's hard because I received some great leadership opportunities next year. I'm going to be the chief resident for medical student education, which I love doing. I'm also going to be one of the chief resident wellness. So I'm learning to back out of stuff. So you'll see probably less episodes as I really try to focus on getting this step done. Obviously, I did do a lot of interviews already. So if you're a medical student waiting around for residency, I would love your help joining our team of other medical students that are in the waiting period, whether they're waiting to apply to residency or they're waiting to start residency. Help us edit their amazing stories of other medical students, doctors, and other healthcare professionals showing their humanity within medicine. I've interviewed some individuals who have also failed exams and are giving advice because they have now taken it and matched this past cycle. So hopefully you can come help us. I've also stepped away from, I was doing a group of medical students who were doing mental health research. I'm really trying to step away from that. Again, just need to get this over with, move on with my life. But you can do it. We're not alone. We are good enough to be here, and you're good enough. Just like I'm trying to tell myself that I believe myself. Take care of yourself, everyone. Make sure you're subscribed and help us encourage each other through putting in the comments. You are good enough to make it through this exam. Either if you're already a doctor or about to become a doctor, I believe in you. Take care.